start. And then let us have a look at the slides that we are going to speak about today. Well, and today we are going to speak about the jobs that that are connected with them working in a hospital. And so we should start with the first slide. Well, it takes some time. And well, do you see?
Yes, ma'am.
Yes.
So first of all, I would like to say something about the previous homework that you've done. That was the task was to submit the results of the work on the site Future Learn with the online course English for Healthcare. And so everyone has done this, and what I want you to focus on is that some of the screenshots were wrong. I mean, they were presented in the wrong way. I mean that it's okay if you take a picture of this of the screen of the computer. It's okay, and it's okay if you send me the screenshot from your phone. But here the problem is that you've given the name, your name here. It's great. That so I can see that whose work this is, but the problem is that I don't see the first letters of your name and surname. And I was speaking about this. Just it should be given in the right upper corner of the screenshot. For example, here there is a box, but we don't see the letters. And that is why I would recommend you to do like this. This is the correct way to present the screenshot. And here, this is like the screenshot is given, and we can see the first letters A and S. And the name of the student is given separately. Just it was a separate message or just something else. And I can see the full name. So I shouldn't guess whose name these letters stand for. And this is also the correct way. I can see these letters MM and the name of the student, Masharif Ahmed. So this is the correct way of presenting the screenshot. Please be careful next time and do like this, so I can see that this is your screenshot. So you did it yourself, okay?
Yes, ma'am. We did it in the actual way, like the screenshot which you are showing on Pedatala Shudishaji is from our group. Everyone from our group have did it in the same way.
Okay. So, and so I mean, that this is the example that are taken from other groups. That is why I'm speaking about this. Maybe there were no problems with your group, but anyway, we should remember this. And now this is the time to speak about the culture projects that you've prepared for today class. And So we were speaking about body language, the culture projects that you've prepared about body language in your culture, then patient-centered approach in history taking, and Calgary-Cambridge method. So let us start with the first one about the use of body language in your culture. So do you have this presentation? Who will be speaking about this?
Yes, ma'am, we have our presentation with us.
Okay, and I mean that I need to go back to our first page, and so there are some technical issues here. And okay, and I need to give you just so to do like that you can also share your screen, right? Wow, we have 15 participants. There should be not then 14. Who else has joined us? Okay. So who is sharing the screen now? Sinju, you?
No, ma'am, the first subgroup will do that first.
And who are they? Will you remind me?
Ma'am, our group, ma'am, the group 1.
What's your name?
Manish, ma'am.
Okay.
Can you see, ma'am? Can you see my people?
Yes.
Yes. We have the culture project 1, and this project is submitted by group 1, and the participants are Jan Parveen, Hala Malik, Sultan, and myself, Danish. And as an introduction, we can say body language makes up the largest part of our non-verbal communication. Example like eye contact, gestures, facial expressions, and this can convey very powerful messages. And we all know that, as William Shakespeare said in Troilus and Cressida, there is language in a eye, her cheek, her leg. And however, there are substantial cultural differences in how people use body language to communicate. That is, sometimes it is very obvious and many times very subtle. And whether in a culturally diverse company or visiting emerging markets, understanding what people mean through their body language can be a challenge. And I will ask Jan Farveen to continue this presentation.
Good morning, ma'am. So let me talk about the cultural difference in body language. We can say that greeting with our handshake. A handshake is widely accepted norm. Even simple handshake can change from country to country or from location to location. When we talk about the Western culture, a strong handshake can be considered as an authority and confidence. In many parts of the South Europe, Central, South America, handshake is longer and warmer. And when we come to facial expression, many facial expression appear to be universal, and different type of facial expressions are happiness, sadness, angry, surprise, fear, discussing, etc. And When next is eye contact. Eye contact is a sign of confidence and attractiveness and moving of head. In this we can say mainly in India. In some part of our India, people just tilt their head when they can when they understand something. And the next one is silence. Though it is a field that void communication, silence can be very meaningful in different culture. In Western culture, or can say in America and UK, tend to silence is a when we become silent, it is that they say that it is a problematic situation. And the gender in many culture where the male which something which can do done by the man will not be allowed permitted for females. Now let me hand over to Sultan.
Yes, ma'am. Good morning, ma'am. Hello, ma'am. Could you hear me?
Yes, yes. Hello.
Telling about the first one is Namaste. It is a symbol like this. It's a little bit confusing that you might have think that it says like a begging or pleading, but it is a traditional Indian sign of bow in front of someone while joining and greeting them with dignity and respect. It is same as like a handshake. And the second one is touching feet. It is also a little bit confusing that it may have some kind of yoga or to tie shoelace, but it is taking the younger one seek the blessing of elder one, and in return the elder one touch the head of younger ones to denoting the blessing. And the third one is using right hand or right foot for the lucky for doing the everyday actions. They use the right hand for like eating food. For example, like when we step on a new house, right foot is considered to be lucky and mandatory. Telling about the fourth one is touching with don't touch anything with your feet. Touching with the feet is considered to be unclean and unhygiene. Obviously, there's a reason that you walk on your feet for everywhere or anywhere else also. Saying wow with using like this, it is when we taste a very good food items, we say it's very super like this one. And the sixth one is accepting prasadam. In temples, after we pray, we accept no, Hindus accept sweets like sweet by this like. And the sixth one like is nodding head and like this one. It can be considered as gesture of head is moved from up and down, something diagonally title. We can, for example, I'm okay, I'm perfect, I understand, like this one. And now I'm hand over this to Hala Malik. Thank you, ma'am.
Good morning, ma'am. The topic I'm discussing is the fields with non-verbal communication. First one, we can say it is sports. In sports, there are many signs used by the umpires or the referees to communicate with the players or the teammates and the audience. And also, within the team, they use many signs and secret codes, which helps them to discuss the strategy and tactics with each other in the group or without making the other group aware of it. Then the second one we can say it is dance or drama, in which the sign language, the non-verbal language, helps to communicate, conceptualize, and make their creativity express without saying even a word. The audience can relate to suppose it's a dance move. The audience can relate to the each and every movement and gesture of the person by seeing it, and they can relate the meaning with the gestures and expressions. Uh, Same goes for drama too. In some example for the dance, we can say that the traditional dance form of India like Bharatanatyam, Kuchipudi, etc. Then next when we discuss about teaching. Next, we can say teaching. In teaching, both the student and teacher plays an important non-verbal, uh, important presence in non-verbal communication. That is, um, if the teacher is taking the class in a strict, steady position, the position, body position of the teacher and student play an important role in teaching. If the student is sleeping on the lying on the desk or not sitting straight or not concentrating, then it may affect the teacher and her or his mood. And same way, the body posture of the teacher also affects the students. Like the way of teacher walking, the way of posture, teacher standing, sitting, all indicate the self confidence, energy, and mood and involvement of the student teacher. And same goes for the students. Then when we talk about the employee at the office, uh, the first thing comes to the mind is the firm handshake that is given between the employees. If the handshake is neat and steady, then it means he or she is confident and uh, ready to take the challenge. And also other things that check in the office are their dressing style, their appearance, their gestures, all matters in it at a employee at a office. If it is meeting an employee is not sitting, the posture of the employee is not ready. If she is dressing like a for party, then it goes as a negative mark for that employee. Then when we talk about interview, uh, then when we talk about interview, the, we have heard many instances in which the interview evaluates a person based on how the based on the non-verbal communication. We have heard that some interviews, people may not ask questions to the interviewer. They interview, they will just look through the CCTV how the person behaved outside the cabinet of the interview, and they evaluate the person on the basis of their gestures, movements, sitting, posture, etc. So all these categories, the non-verbal communication plays an important role. It helps to show the person's individuality, their confidence, their strength, etc. Then let me conclude this presentation by saying that the non-verbal communication is really important in our daily life. It helps to reveal the one's self-confidence, one's culture, one's behavior, etc. in an exact manner, and it also helps to let other people, the people of other religion, know about the culture of one region, as the mode of transportation and the increased income has helped to people to travel one place to another, which by traveling people can see other people, which help them to see their etiquettes, their culture, their value, their styles, and the way of communication, which helps them to learn about that country too, and helps in globalization and multiple culture working. That's all, ma'am, from our side, ma'am. Thank you, ma'am.
Thank you so much. It was very interesting for me. But what I would like to do is to go back to my presentation, and because here in my presentation we have some criteria for evaluating group presentations, and so here we can. So I need to share. Yes, first I need to share my screen first. Well, and then well, your opinion with them, to share with us your opinion, what you think of the presentation that we've just seen, and if we are lucky, we'll see this slide. Well, okay. So, no, we are not lucky. Just a minute. Yes. Okay, and so you see, when we think what is good and what is bad in presentation, we need to have some criteria for evaluating it. And here, I would like you to focus on the following just aspects, issues like when we speak about the content of the presentation, we should answer the question, is the presentation informative and interesting? Then we should pay attention to the organization of the material. So if it is organized logically. The next point is delivery. Are the speakers talking about the slides rather than simply reading them from the slides to the audience? The next point is visuals. So it is about, do visuals help illustrate the important points of the presentation, or do visuals use keywords or graphs instead of sentences? And the last one here is the impact. Was there a clear thesis or point to the presentation? And I would like the other students who didn't participate in the first presentation to think about this criteria and to comment what you think of the presentation. So do they match the criteria which are given on this slide? Does anyone want to analyze the presentation, to say something?
May I, ma'am?
Okay.
The presentation was really good that they used so many pictures, and those pictures actually illustrated what they meant to say. For example, you can say that when Sultan said about the gestures mainly used in India, those were actually correct, which can be they can miss this points and mainly in so many presentations, but those pictures were so helpful while he explained all of that. And in Hala's part also, there were so many pictures. For example, the one which was used to say how an interview goes in some of the companies, saying how their gestures were used to identify what their behavior is. So it was also nice and was also informative.
Okay, so you mean that they meet the presentation meets all the criteria which I'm speaking about, right?
Yes, ma'am.
Mm-hmm. Does anyone else want to say something? Okay, maybe we can. So, can you recommend something to anything to make it the presentation even better? Give any kind of recommendation. What would you recommend? Nothing. So the presentation is perfect. Okay, good. So now we have another group of presenters. Let's go to our first.
Okay, ma'am. So can I share the screen?
Yes, yes. I'm working on it. Yes, start please.
Okay, ma'am.
Mm-hmm.
Now can you see it?
Mm-hmm. Yes.
Yeah, so good morning all. Today we are going to present on the topic, what does a patient-centered approach in the history taking means? So here we are going to the presented people are Hepzibah Shibu, that is me, Labib TU, Taib Jabbar, and Sinju Mary John. These are my group members. So firstly, on talking about what is the patient-centered approaching in the history-taking means. So there are subtopics regarding to our portion. That is, you can see that in the presentation. You can see that educating people about their conditions, then encountering questions and collaborations, then discussing how the condition affect the patient emotionally, and involving patient in treatment decision. So my topic is that educating patients about their conditions. So while we are talking about that, how can we educate the patient regarding their about their condition? So firstly, first point is that we must focus on the patient's education. We must know that whether the patient is greatly educated, well educated or not, because while on discussing about their diseases, they must understand what we doctors meant to explain to them. That is on telling about an example. On telling an example, well, when a person is well educated, we can give them through simple words. We can discuss their diseases through simple words. And if a person is illiterate or not educated, we must give more explanation regarding their diseases. And the second point is that correct the misinformation in patients. That is, many people have incorrect or misinformations about their diseases, because in olden times, most of the people follow their myths and misconceptions. So they must, we must correct the incorrect informations regarding their diseases among the patients. And the next point is that give information about the severity of the disease that require attention. We know that some of the diseases are highly severe and some of the diseases are not severe much. That is we must tell how severe their diseases is and ask them to take care themselves regarding the severity of the diseases, and some diseases require more attention. So we must ask them to take more care for themselves, and we doctors also can help them. And next one is how and when to refill the medications. So we must ask, so we have seen that on consulting a doctor, doctors explain us how we must take this medications and when. And if we even if the medicines are from our hand is finished, we must again, some doctors may tell us to again to consult the doctor and refill the medications. The next point is that think about the patient's limitations and strength. While we are talking on this point, we must know that how the patient is strong. That is, if a patient is older one, most among the patients, that is all people may lack much strength. So we must look after their mental stability, and also according to that, we must prescribe them the medicines. We must prescribe the doses according to how healthy this patient is. Then next one is that include the family members in their healthcare activities. While we are talking that most of the people are attached to their family. So if we include if we include these patients in their medications, they'll be more relieved, and they will be accepting to work on their to participate on these healthcare activities. And the next one is consider the patient's concern. Consider the patient's concern. On talking about considering the patient's concern, we can know that how tensed is the patient's, even how tensed these patients are, because some of these are severe diseases, or some of them are less severity. So if it is severe diseases, this may also affect their mental stability. So we must concern about the patient's conditions. And next one is that use the advantage of the present educational technologies. That is, we know that nowadays the world has developed well with good technologies, and we have a good systems nowadays, and now we can see that as an example, that is in COVID. Now it is COVID situation. So we without going directly to the hospitals, most of them register through our computers, and this is a best example for using technologies. So here I have spoke about the educating patients on about their conditions, and this is all from my part. I'd like to hand over it to Labib.
Yes, ma'am. I'm Labib, and my part is encountering questions and collaborations. And first of all, we must follow an effective evaluation process. That is the ongoing and consistent surveillance of a patient's which studies shows is an often missed or omitted aspect of care. And also, this omission often leads to injuries arising from the patient's underlying diseases that could have been prevented through early detections and also by appropriate and timely interventions. And also evaluation is documented as following a standardized framework that facilitates the communications and knowledge sharing of the patient's overall status. And the second one, we must use a clinical decision support tool for patients' care plans. And also one big mistake the most organizations make when creating care plans is to develop them as a series of tasks or activities that are timed and scheduled to populate the work list. And also with this approach, care planning is often reduced to clearing tasks from this work list. And also we must clinical teams needs to view care plans as an opportunity to provide their colleagues with a powerful clinical decision support tool, and that is fully integrated into their everyday workflow. And also the next one is that we must focus on the patient's education. That is one of the most frequently omitted aspects of this patient care is one education. And also the most common practice is for education to be done when discharging a patient. And also engaging patients by providing them relevant and timely education is critical to ensure adequate transitions of care. And also a successful patient's education program starts on admissions. And also the next one is what ask more questions. So we must ask more questions about this patient's whether about his disease and all. And next one is we must listen to the patient's answer without interrupting. When a patient when a patient starts to speak about his disease, and we must concentrate on him. And also the next one is what validate the patient's concern. We must always validate the patient's his or her concerns. And also next one is we must make an eye contact. Okay, when if a patient starts to speak, and also if we are not listening to him, or you are so looking here or there like this one, the patients feel so much that the doctor is not listening to him. So in order to avoid this bad feelings of these patients, we must always make an eye contact. And ma'am, that's all from my part. Now I'm handovering to Toyib.
Well, I'm sorry to interrupt. Unfortunately, we have less than 2 minutes, and I think so it takes more time to speak about the next slides. And now